You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Dahlman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a mother-to-baby specialist at 866-626-6847, by text at 855-999-3525, or through our website at mothertobaby.org. Welcome to another episode of the Mother to Baby podcast. My name is Chris Dahlman, and I am a genetic counselor, a mom of four, and a teratogen information specialist. So what that means is that I talk to people, so patients, families, healthcare providers, about exposures that can happen before pregnancy, during pregnancy, while breastfeeding, and in cases of adoption. And an exposure can be anything. So it could be a medication that you're taking. It could be a cosmetic procedure that you have questions about. It could be something in your workplace. Really anything that can affect someone before, during, or after pregnancy. And today, we have a special guest, someone who's been on the show before, to talk with us today about pregnancy and delivery later in life. Dr. Shannon M. Clark is a double board-certified professor in obstetrics and gynecology and maternal fetal medicine specialist at the University of Texas Medical Branch in Galveston, Texas. She is a social media health educator with tens of thousands of followers, on Instagram, TikTok, and other platforms. And she previously joined our podcast for episode 51, which was high-risk pregnancy and birth defects prevention. We are thrilled to have her on again. Dr. Clark, welcome back to the show.
Thank you. Thanks for having me back.
My pleasure. Okay, so this is something very close to my heart as someone who had pregnancies later in life. I know a lot more women are. And we hear this all the time, that women are getting pregnant and giving birth later in life. Are there increased risks when a woman is older during pregnancy and delivery? And at what ages do we start to see these increased risks?
Yeah, that's a good question. And actually, ACOG just came out with a really nice document called Pregnancy at Age 35 Years and Older. I think they came out with it because of the things you just mentioned. More and more people are getting pregnant later in life. So this is the first document they put out, and that came out in August last year. But yes, advanced maternal age individuals, meaning those that will be age 35 and older at the time of delivery, are at increased risk for certain things. The first magic thing that happens at age 35, if you will, is problems becoming pregnant. Then problems staying pregnant with fertility or pregnancy loss issues, and that's mainly due to genetic abnormalities of the embryo due to advancing age. And then finally, we think about if there is a genetic abnormality with the pregnancy and that pregnancy does progress, there's an increased risk of congenital anomalies or birth defects, as they're more commonly known. And then finally, as we get older, we get more disease processes. And the ones you think about are diabetes and hypertension, but other things can happen as well with advancing age. So for all those reasons, age 35 is considered advanced maternal age, although it's on a continuum, meaning these risks might start a little bit earlier for some people, later for others, and it doesn't just automatically all this hit you at one time at 35, but it can vary based on this continuum, and things can be more and more, there can be more risk with the even more advancing age, particularly over age 40.
And this is a topic you personally have experience with. Can you tell us about your connection and why talking about giving birth later in life is so important to you?
Yes, so I, as a healthcare professional and a physician who trained for a long time, I did delayed childbearing, and I didn't marry until I met my now husband at 38, married at 39. We started trying to conceive at age 40. It took us about 6 months or so to get pregnant, and that ended in a miscarriage. Then we went straight to IVF. I went through 5 cycles of IVF. I had diminished ovarian reserve or declining egg quality and quantity just based on my age alone because I was very, very, very healthy. And I had no chronic medical conditions. And that's just the result of my age. I was over age 40 and trying to get pregnant. So after 5 failed attempts at IVF with my own eggs, we did decide to go to donor eggs. And that's how I conceived my twins, who are now 7. And then I had a complicated pregnancy as well. So I kind of experienced the whole gamut of what you could experience as a high-risk pregnancy, of advancing age. I pretty much had it all. So not only is that my job, but I was a patient as well.
Yeah, that sounds like quite a lot. Like you said, you ran the whole gamut there. You had the whole experience. And it's interesting too, certainly many different ways that folks get there. I know you said, your extensive education and work in the field was, ended up in your delay of getting pregnant. And for me, I got pregnant pretty early on in life with my first 2 children and then had a very long gap in between it, which, I started my career. So people can get there all different ways.
Yes, that's true.
So thinking about women of reproductive age in general, they can be affected by chronic inflammatory diseases, things like, rheumatoid arthritis, psoriasis, psoriatic arthritis. And some of these people may come to pregnancy a little bit older if it's taken time to get them the correct diagnosis or to find the right medication or treatment that works for them. They're feeling good finally, they're ready and comfortable and able to have a pregnancy. What should a person who is older and managing a chronic condition need to know about pregnancy and delivery?
So I think and this is for any chronic medical condition, the first thing is to have whatever condition you have that is considered chronic as well controlled as possible before conception. That allows for the best control possible. If you are planning on pregnancy later in life and you've been on certain medications for whatever chronic condition you might have, then you would have time, if this is a planned pregnancy, on addressing what medications you're on and making sure they're pregnancy compatible. And if they're not, altering the medications or changing things so that it is more compatible. There's a lot more time for planning, getting your pregnancy care team on board, making sure there's nothing else that you need to take care of before that plan, you start trying to get pregnant. That's ideal if we can plan pregnancy, but that doesn't always happen, and that's fine too. If you do find yourself pregnant unexpectedly as someone of advanced maternal age, the first thing that you don't want to do is stop all your meds. Because, if you're on something, that's not what you want to do. I know that's what a lot of people tell individuals to do of all ages. And even some providers tell you that, but that's not the right thing to do if you're controlled on those meds. You do need to seek care early as soon as you find out you're pregnant. When you make that first call, to whatever you're going to go get your pregnancy care, say, I'm on these medications. What do I need to do? Or call whoever's been managing those medications and say, I'm pregnant. What do I need to do with these meds? The answer is not always to stop. The answer might better be, we need to either adjust the dosage or change over to a different, type of drug for managing this condition. The last thing you want to do is just not manage the condition because you're pregnant. We need a healthy pregnant individual. Yes. So this school of thought of just stopping everything for the sake of the fetus, it doesn't matter. Nothing's going to matter for the fetus if the pregnant individual is unhealthy because they stopped all their meds. So that's the last thing you want to do. So if you find yourself unexpectedly pregnant, please don't do that. You just call, your sexual care provider, call who's been prescribing you those meds and let them know you're pregnant. See what the alternatives are, if there's anything that needs to be done for those medications.
I cannot thank you enough for that reminder. I think that, and some of it, I think, is the impulse to want to, not take any medications in pregnancy. But I mean, firsthand, you couldn't be more correct. Stopping them is not going to be ideal for everybody. And I really appreciate you giving a step-by-step. You find out you're pregnant, get on the phone, let, your provider know that you're pregnant, remind someone that you're taking these medications and see where to go from there. And I couldn't agree more that you need to start with the person who is pregnant and make sure that they're doing well, because then a healthy pregnancy is more likely to follow. Thank you. Thank you. Thank you. Thinking about rheumatoid arthritis, specifically, Mother to Baby actually has a pregnancy study where we look at people who have rheumatoid arthritis taking certain medications, and there are lots of options for treatment, whatever your condition may be. So if you do have any chronic condition, absolutely ideal would be to manage everything with your healthcare team beforehand. And if you can't, talk with them as soon as you know you're pregnant, and they can put you on the right path.
Yes, exactly. And this is another important reminder. If you're on any medications and you find yourself pregnant, if you go Google that medication and look for pregnancy registry or go to Mother to Baby, you could find access to registries, and that's how they collect a lot of data on medications, is by people who are already on these medications and happen to become pregnant. So always consider that. That helps us, and it helps, take care of patients with similar conditions. It helps us get more information on the medication, get more safety data, other types of data. So just remember, go to Mother to Baby Otis, or you can just Google the medication. Like, I don't know, say you're on some type of steroid, or you're on some type of other medication, and then dash pregnancy registry, and sign up for that pregnancy registry so you can be followed, just to see what your pregnancy outcomes are.
Absolutely. We get so much information from people generously sharing their pregnancy experiences with us. Thank you. Great reminder. So let's get to some of the misconceptions about giving birth at a later age or getting pregnant at a later age. What do you hear? What have you seen? What can you share?
I think are some people who get pregnant later in life very high risk? Absolutely. There are some people who are not only at maternal age, but they have some very serious chronic medical conditions. They're on some medications, and they may not be in the best health, and they are considered high risk. But age alone is not necessarily I say this every time I can. I heard this saying somewhere, and I'm sorry, I don't remember where, but just because you're considered high risk doesn't mean your risk is high. So yes, being 35 and older, you should be considered high risk, because there are certain things that we have to watch for in persons who are who are going to be delivering after age 35, and especially after age 40. But it doesn't mean your pregnancy is going to be fraught with complications, or you're going to have, to deliver early or anything like that. No, but that arises, as it would, we handle it as we would in anybody, of any age. But, we do have to take that seriously. We can't just write it off. And even if you are healthy, we still have to take it seriously. And it doesn't mean that, you did anything wrong or that you're guaranteed to have complications. But you do want a provider who does take that seriously and is going to do the right thing for your pregnancy.
Such a good reminder. I think that very often at least I did. I'm only going to speak for me. I got super head up. I gave birth for the last time at age 40, and everyone was like, high risk. And, you get that, but it gets really scary. And, it was a pretty smooth pregnancy. It's not always going to equal a complication. I think that's a good thing to remember, but just keep in touch with your providers, and, they can guide you.
Agreed.
So, Dr. Clark, before we let you go, what is a final thought you would like to leave our audience with?
So the final thought I would say is this. Yes, we are delaying childbearing for a number of very valid and very good reasons. I would not change my training and what I ended up doing with my life and career for anything. However, I had problems getting pregnant when I finally was trying to become pregnant, and that's just the reality of delaying childbearing. If you anticipate delaying childbearing for any reason, stay up to date with all your health, women's health care exams, any exams that you need. Keep up with your health. Do all the necessary testing that's needed. Even see a reproductive endocrinology and infertility specialist just for a baseline intake exam, just to discuss your plans and see if they see anything in you that might need special attention. You can go there to see these docs just for those types of visits, the consultative visits. Say, hey, right now, I'm 34. I don't think I'm going to have a baby until I'm close to 40. Do we do any blood work? Do you think there's anything that I need to do to help keep my fertility as optimal as I can with what I have control over? There's a lot we don't have control over. Yeah. So be proactive. Be proactive about delaying your fertility. right? Don't just delay your fertility, but be proactive. And if you understand that that's going to be your reality, make sure you're taking care of yourself. You see that fertility specialist to see if they have any additional recommendations, and do everything you can to get educated about the potential consequences of delaying childbearing.
Great advice. Great advice. Mm-hmm. And it's, again, just a good reminder. Yeah, you can put it off if that's what's going to work for you, but keeping folks in the loop, having a plan as much as you can for the future. That's excellent. Yes. Dr. Clark, once again, thank you so much for being on the show. We're so happy to have you here. This is great information. Thank you a million times. Thank you, not just for this, but also for the work that you do.
Thank you so much.
And Dr. Clark, just remind us, where can our audience find you on social media?
So I'm the most active on Instagram at Babies After 35, but I also have a TikTok account at TikTokBabyDoc, and a Facebook page at Babies After 35. But if you want to follow me, and I have more, there's more of a ability to have more information under the Instagram highlights, I would suggest following me there at Babies After 35.
Awesome. And all this information will be in the show notes for this episode, so you can find Dr. Clark where she's out there educating.
Thank you.
Thank you. And that's going to do it for this episode of the Mother to Baby podcast. As always, remember to hit that subscribe button. That way you never miss a new episode of the show. And you can also go back and either listen or re-listen to some of the older episodes. If you have an idea for the podcast, or if you want to be on the podcast, we want to hear from you. So feel free to email us at contactus@mothertobaby.org. And remember, Mother to Baby is here to help answer your questions. You can reach us by phone at 866-626-6847, by text at 855-999-3525. You can visit our website at mothertobaby.org. There, you can find our many information pages, our baby blogs, links to our podcast, are hundreds of fact sheets that are free and available in English and Spanish. You can chat with a Mother to Baby expert, and you can find out how you can help with our pregnancy studies. And remember, Mother to Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.